Hello, I'm Renee Seiler, an ambassador for Susan G. Komen for the Cure and a woman with a very personal breast cancer story. You see, both of my parents had breast cancer, and because of that, I opted for a bilateral preventive mastectomy in January of 2007. It was a very difficult choice for someone who didn't have breast cancer, but it was the right choice for me. If you have had a mastectomy or you're about to undergo a mastectomy, you might be considering breast reconstruction, and if so, you're going to need some information to help you make that decision. Joining me now is Dr. Joseph Disa, a plastic surgeon with Memorial Sloan-Kettering. Dr. Disa, hi. Thank you for joining us. Good to see you again. And in the interest of full disclosure, I have to say you were my surgeon, so it's good to see you in this setting versus how I've seen you before. I want to talk a little bit about the pros and cons of reconstruction versus prosthesis. Some women choose not to reconstruct, right?
That's correct. Reconstruction is something that is a permanent thing. A prosthesis, you put it in your bra. It's an advantage because it's the simplest thing. It doesn't require any additional surgery or doctor's visits or things of that sort, but it is a temporary device. And the larger your breast, the more cumbersome the prosthesis can be. And if you're wearing clothes with a lower neckline or you're trying to go to the beach or wear a bathing suit, it's easy for some women, but it can be quite a challenge for others.
Because in my case, and I don't mind talking about this, I've told my story many times, I did have the immediate reconstruction. Is it sometimes in the case that women who maybe have a mastectomy, who actually do have breast cancer, and I did not have breast cancer, but women who have breast cancer, they're going to be facing other surgeries, chemotherapy, radiation, that kind of thing, that they just don't want to go there right away?
Yep, we definitely see that. Sometimes it's recommended by the either medical or surgical oncologists that they don't have reconstruction because the disease is particularly aggressive and they don't want to have anything that delays the chemotherapy. That's one issue. Some people just can't decide and they're not sure if they want it or don't want it, and they'd rather think about it for a while and delay it until, either after the surgery or after any adjuvant treatment that they might need.
Is there a time frame on when they have to make that decision, or can they 10 years down the road say, I want to have it done?
Absolutely, they could make it at any time. Breast reconstruction is a woman's choice, and there's a federal law in place that entitles women to have insurance pay for reconstruction. And any parts that have to do with the reconstruction at any time at the mastectomy or any time thereafter.
Are there some women who are better candidates for reconstruction than others?
Absolutely. Reconstruction adds its own set of additional surgery and potential problems. If a person has a lot of other medical illnesses that may not allow them to have prolonged anesthesia or additional surgery, they may not be an ideal candidate. Someone who's a heavy smoker may not be an ideal candidate because smoking can affect the circulation to the tissues that are used to cover the reconstruction or as part of the reconstruction, so they may have poor healing. People who are going to have radiation therapy as part of their treatment. People with particularly aggressive breast cancers are often treated with mastectomy, chemotherapy, followed by radiation therapy. And radiation therapy, it's very controversial, but in general does not do good things for a breast reconstruction. So although you can have immediate reconstruction and then get radiation, there is a potential argument to say, I'd rather get all my treatment and then delay the reconstruction until after the radiation.
How would a woman go about finding a good plastic surgeon?
Well, I think it starts on two fronts. Usually if they have a breast surgeon who works with another plastic surgeon and they're comfortable, then there'll be a referral set up by that breast surgeon to another plastic surgeon. That's number one. Number two, research the person that they're going to see. They should make sure that that person's certified by the American Board of Plastic Surgery. They could go on the website of the American Society of Plastic Surgeons and look for their surgeons. They can find a little bit about them. They should find out first and foremost, does this surgeon do a lot of breast reconstruction, or does he do breast reconstruction at all? I would say that the best people to do the job are those who are certified by the American Board of Plastic Surgery and who do have a practice that breast reconstruction is a significant part of.
And who you like.
And who you like, absolutely. You have to like the person and trust them because that's part of the doctor-patient relationship.
Thanks, Dr. Disa. Good to talk to you.
Thank you, Renee. It was nice to see you too.
For more information, visit the Susan G. Komen for the Cure website at www.komen.org, or you can call the Komen for the Cure helpline at 1-800-I'm-AWARE. I'm Renee Seiler.